Hi, I am David Lee. I'm an acupuncturist and a practitioner of constitutional Asian medicine. Today, I will be going over case 243 with you. This patient was a little challenging because it took me some time to figure out how this patient's physiology works and what I needed to do so that the treatment is very well targeted for her improvement. I take this as an opportunity, not because it was a straightforward process, because I had to think through and find out what this patient had needed. Thankfully, the outcome was really good. The patient had really good recovery and back to normal, and even better than she was when she was in a normal state. So let's go over case 243. This case was using constitutional Asian medicine, which I do for all my patients, and I've utilized Bisoma acupuncture, Tetrasoma acupuncture, and Sasang herbal medicine. Okay, now here are the presentations that the patient had come in with. She had profound fatigue and depression. Female, age 49, and a department store manager, which meant she was working at least 8 hours a day, 8 to 10 hours a day, and she had a lot of customer service to do, at the same time helping out the department functioning for the employees to work in a smooth manner. The symptoms began when after she had the full anesthesia for septoplasty 2 months prior. 2 months ago, 2 months prior to when she first came into my clinic. The patient was profoundly tired, weak, and mentally foggy. The symptoms were unusual because she had a happy and easygoing personality. And she also had some aching in the right arm and the elbow, tense neck and shoulders, not much, but some. And she also had menopause symptoms of hot flashes once a day and mild night sweats 2 to 3 times every evening. Not so bad, but she had some. And she had chronic bowel movement issue, and the bowel movement occurred every 3 to 7 days. She came in for acupuncture twice a week for the first 2 weeks, and then once a week. So far, she had 18 acupuncture treatments. On the first day, I gave her the right side yin horary points in wood order. Wood order because the well point is wood, and then the spring is fire, stream is earth, river is metal, and sea is water. So it's in that order of wood, fire, earth, metal, water. First point, the well point is liver 1. Heart 8 is the second point. Third point is spleen 3. Fourth point is lung 8. Fifth point is kidney 10. Those are the horary points. Liver 1, wood point on a wood channel. Heart 8 is fire point on a fire channel. Spleen 3 is earth point on an earth channel. Lung 8 is a metal point on a metal channel. And kidney 10 is a water point on a water channel. As you can see in the illustration, those are the classical acupuncture points. So the horary points are the element points within the same element channel, which means is that it has a very wide application and deep application. It's not as specific as other acupuncture points. Each acupuncture point does a lot, and the beauty of the acupuncture is that it is not disease focused, it is human being focused. Human body identifies and treats a lot of variety of things, and that's where you want to tap into. Have the body do the job rather than intervening for the body. And the acupuncture is a very convenient way to do that. More an acupuncture does, the better it is. More variety of things it does, the better it is. That's why horary points are highly valued. Those are reactive points for the patients, not reactive points for the syndrome, not for the disease. Well, after the first treatment, she had no relief. Okay, well, even if it's a correct treatment, at times it requires several treatments to see a relief because everybody has different rate of improvement. In this case, I decided to switch that around because most of the patients, or majority of the patients, have significant relief, noticeable relief after just one treatment. Normally, you want to give 2 consecutive of the same points and then assess and see how the patient responds. It should be even 3 treatments. But in this case, on the second visit, I changed the points to alternative, which is in the metal order. Because even if these are yin points, some patients have metal order sequence on their well, spring, stream, river, sea points. So in that order, the first point, the well point, is the metal. Second point, spring point, is water. Third, stream point is wood. Fourth, river point is fire. Fifth, earth point is earth. So in the order of metal, water, wood, fire, earth, just as would yang horary points or yang 5-element points would. Therefore, the 5-element layout becomes different for this patient. Lung 11 is a metal horary point. Kidney 2 is a water horary point. Liver 3 is an earth, a wood, wood horary point, liver 3. And heart 4 is a fire horary point, and spleen 9 is an earth horary point. So I gave those points to her, and this is how she reacted. On the third visit, treatment 3, the patient came in and said, you know, the last treatment was not good. On the same day, because she had the treatment, the second visit in the morning, and then she went to work afterwards. She was profoundly tired, she had headache, and she had to leave home early, so she just couldn't function throughout the day. But the good thing was that she had a bowel movement daily since the second visit. And there was a mixed response. It was good in one way and not so good in another way. But the fatigue and weakness in the legs only lasted a few days, and in the 3 days prior to the third visit, she felt even better. And there were some symptoms that didn't change, which were the hot flashes and the night sweats. And so, well, maybe because she did not have any change with the first treatment, I decided to go with the first treatment, which was the right side yin horary points in wood order, not metal order. And I kept repeating that treatment into the next visits until treatment 12. All right, let's go with. So from 4th to 9th visit, she had acupuncture only, and the treatment, right side yin horary points in wood order, was effective immediately and for a few days. She felt like she was starting to get herself back, but after a few days, she still had experienced tiredness and weak legs by the end of the day. And her mind was not too clear, It was foggy, and the hot flashes were not getting better. They were staying about the same. So I gave her on the 10th to 12th visit Sasang. Korean Sasang means four constitutions. So Korean four constitutional herbal formula is called Sichuan Dabutang. SHIQUAN That's all inclusive formula, and that includes Baitsu, Baishao, Zuganzao, Huangqi, Rogwei, Dangquai, Chenpi, CHEMPI, Chuancheng, Heshou, Shengjiang, and Dazao. And this formula was a little bit helpful, but she was still experiencing the night sweats and the intense enough fogginess in the brain and tired by the end of the day. So I changed to a different formula, and I also changed the acupuncture because within 12 treatments there was no significant advancement. Although there was a little bit, it was not lasting, or significant improvement, but that was not lasting after a few days. And overall there was a little bit of improvement. So she kept on coming with the hope that eventually it'll add up. And besides, she was feeling better for half the time, and therefore it was something that she was hanging on to. It was better than not getting acupuncture. I changed the acupuncture points to metal order, the lung 11, kidney 2, liver 3, heart 4, and spleen 9. Although that caused her fatigue, for 3 days, I thought maybe I should not continue with the wood order expecting different result. And good thing was that from this point on, the metal order did not cause any fatigue. Actually, it was even better than the result of wood order points. So by the end of the day, she was experiencing less tiredness and weakness in the legs, although she was working at a department store all day long. And her night sweats were much better. From the 13th visit, though, I did give her Buzon Ichitang and Shenyang Ichitang. These herbal formulas are great in spontaneous sweating and hot flash sweating. These worked for her better than Sichuan Dabutang, the other formula, which had Chuanxiong in it, CHUANXIONG, which can aggravate sweating. So rather than using that formula, I switched over to another formula that's also a tonic to help build her up for her organs and glands and her immune system and her hormone system. And it's well known for spontaneous sweating and hot flash sweating. Buzon Ichitang, Shenyang Ichitang help to a certain extent. Because her symptoms were persistent and she had her physician, MD physician, she had an examination, and the examination showed that she had Graves' disease, which is hyperthyroidism. And that had prompted me to do a couple of things, which was, by this time, I recognized her body type as a dry cool type. Okay, cool type, cold type has deficient earth and excessive water. It's a cold type because it has deficient earth and excessive water. And this patient is a dry type because she has excessive wood and deficient metal. When you combine these two together, dry and cool, then the fire is also deficient. So I have different ways to determine the body type of this patient, psychologically, physiologically, and by physical shape. By this time, pretty clear this is a dry and a cold type. And besides, I established that a few treatments prior that she was a cold type. That's why I gave her warming herbs, warming formulas for lesser yin constitution, which were Shichuan-Dabutang, Shenyang-Ichitang, and Buzon-Ichitang. The Graves' disease diagnosis was a prompt for me to give her the Sasang formula called Guizhi Bansha Shengjiangtang. And this is a great formula. I'll talk about it after this slide. And this formula was the one that got her coming back to normal much better than acupuncture did. So in this case, I added lung 5, heart 3, liver 8, and kidney 10 as her central element, which is an earth, to have it be better balanced, because her earth was deficient and her neighbors, which were fire and metal, were tonified because they're situated next to the earth. The generation cycle goes both clockwise and counterclockwise. When the earth goes up, the metal also goes up and the fire goes up. The distal elements, the water and wood, they get controlled because earth goes up and then the already excessive wood and water elements, they get pressed down. And then as an overall effect, you have a balance, because when you increase the earth, the water and earth goes down, which were already excessive, and the deficient fire and metal, they both go up. And this addition of acupuncture points, the outcome, her feeling better, showed that these were the correct points for her. Now with the next slide here, I'm going to talk about Guizhi Bansha Shengjiangtang a little bit more. This is used for clumping in the chest syndrome. The herbal formulas are Shengjiang, Guizhi, Bansha, Baishao, Baizu, Qinpi, and Ziganzao. You notice how the herbal formulas are similar to each other. They're different by 1, 2, 3, 4 ingredients. But there's the other formula also had Shengjiang, Guizhi or Rogui, Baishao, Baizu, Qinpi, and Ziganzao. And so Buzon Ichitang would have most of these, Shenyang Ichitang also, and Sichuan Dabutang. However, just a change in 1, 2, 3, 4 ingredients makes the formula very, very different. The function of the formula becomes very different. In this case, just that change in Bansha, introduction of Bansha, treats the clumping of the chest syndrome for this cold constitution very well. And so the signs related to this would be, well, you gotta make sure this person does not have excessive sweating. This person has some sweating, but not so excessive. So no spontaneous sweating, some sweating would be fine for this patient. The clumping of the chest syndrome is another word for liver qi stagnation, or that pig running syndrome that goes up in the throat. That's also liver qi stagnation. Liver qi stagnation is something that's constrained in the middle, where the balance between the upper and the lower is not proper. So there's not a good up and down circulation because it's stuck down here. The reason why it got stuck down here is because although she had a personality of being happy and easygoing, that's the way she was since childhood, it's that the life was not easy to live. Her husband was going through brain cancer treatment, and her daughter also had an issue of attempting suicide. So her being stuck, being able, trying to keep the family together, it really affected her mental health, and that became constrained and was a liver qi stagnation, and that needed to be relieved. That's why the other formulas did not work as well. And the Graves' disease, hyperthyroidism, is a classical symptom of excessive upset, stress, anger that got pent up inside. And to release that, this patient needed 鬼子板下生姜汤. So the key indications are pains accompanied with stress, such as fibromyalgia, hypochondriac pain, so pain in the ribs. Fibromyalgia is pain all over the body, in the muscles, and the pain is registered in the brain as opposed to pain is coming from the senses, outside from the musculus, tendinal areas. It's not that. The brain just interprets the pain within the brain, not the senses coming, not because the senses were coming from the outside of the outer part, or from the peripheral nerves. Common disease indications are acute chronic emotional stress, anxiety, depression, anger, upset, and irritation. Fibromyalgia. Clumping of the chest. Manifestations are clumping of the chest is like a constraint in the chest. So when you feel the sternum, some people go, ow, this hurts a lot. You're just touching very little bit, or you're touching the angle of the costochondritis, intercostal ribs right here, or the angle of the ribs, and the patient also screams because it's very painful, even on a light touch. So the symptoms are facial flushing, sternal pain, stifling sensation, and tightness in the chest muscles, costochondritis, and fullness, and focal distension under the xiphoid process. So under the ribs, it feels full and distended. Palpation causes moderate to severe pain in the sternum and inferior to xiphoid process. So anywhere you press around here, even lightly, will cause the pain to be severe. That's a classic symptom of clumping of the chest syndrome, or liver qi stagnation. So I hope this helped you out in the process of how I figured out how to do the treatment properly. So there are choices. I did not have to go too much outside of the choices. Within the prescribed choices, within the format, I worked towards the targeting of the bullseye. Beginning, I was in the ballpark. Okay, I was somewhat inside. Nothing was really, there was no aggravation except those few times, but it probably did not have anything to do with the acupuncture or herbs, maybe a little bit, but not so significantly. And then as you see how the patient responds, you hone in, you refine the treatment so you hit right at the bullseye of the target. Because when you hit the right spot, then rest of the body responds very well. And with this Guizhi Bansha Shingang Tang and metal order of Yin Horary points, the patient had recovered much quicker, to a point where the patient was doing well mentally and physically, within normal range, and better than she was for a long time.